make an interesting point there. A lot of people, they come in and they give you this like quote from the patient management system, like it's almost like a parts invoice. It's like the stuff I used to see, like when I was like doing IT for engineering, like, it's like, I need 6 units of this, 5 units. It's like, I'm not building a motor here. Okay. It's a human being. Like, so I think, if you show them, it's like, here's what we did for this patient, and here's kind of the journey, they can put themselves into they can more visualize, what the end result is going to be like. Because I think that often, they're just handed this quote. It's like, okay, call us back when you're ready. It's like, what am I looking at? You're going to need 2 implants, going to cost this for the X-ray. It's going to cost, they itemize everything. It's like, I'm not buying, supplies at Home Depot here. It's a journey.
Yeah.
So did you find that when you're using this work, you're seeing more case acceptance, or, obviously you've been doing it for years, so you wouldn't have continued to do it if you didn't see any impact, right?
Right.
So walk me through what felt like once you had more of these case studies, what changed and how were you using them? It's like, would you pick out the right one for the right person, or would you go through a few of them? So how does that treatment presentation work exactly?
Yeah, I'll give you a couple of pearls on this one, because I think it's very valuable for your audience. So one of the things that I would write down for everybody, because to me, the visual side of things, and the course that we teach around that is really it's kind of inextricably linked to the sales side of things. You've brought that up a couple of times, and I think it's really, really great, because you have to have just being emotionally attached to something visually and seeing that. You still need the experience behind it. You need someone to walk you through it. You get this parts list. I can have some visuals there. That's going to help, but you still have to walk me through as a human being from step 1 to completion. And so there's a process there, and that's a sales process. That's a case acceptance process, and it has to be ordered and it has to make sense. So the way I look at it is this: I imagine that every person that comes into my practice doesn't know anything about what I'm going to propose. And we're a very total health, comprehensive focus practice. That doesn't mean everybody gets a full arch. It just means that I'm looking for what's the comprehensive solution for you. And that's the direction that we're going to take you, which usually means higher dollar amounts, which means more hesitancy, more reticence to accept that treatment. Yes. So this is what I want your people to write down. Sales can be boiled down to a very simple phrase. It is the calibration of a person's internal values to your external value. Meaning, if a person values honesty, integrity, evidence-based stuff, visuals, you name it, those are internal values that they have. You gotta go buy a car, you're looking for certain values that are represented in the thing that you're going to buy. That's why we buy things, is because they validate our internal belief systems. So you have to raise, if you're saying, hey, it's a $50,000 treatment plan, that number is going to be really shocking to somebody if their internal values do not validate your set point. So the whole process of sales is step by step getting a person to a place where their internal values look at your dentistry and say, oh, if I have that, I get to experience life this way. I get to embody health this way. It gets to impact my life this way. So unraveling the whole puzzle, what I would suggest then is that if you're going to look at how to implement a few pearls right away, the first thing is insert visuals at the right place and the right time. Dentists want to jump towards educating a patient right away, and they overeducate them into analysis paralysis.
Yes. Yeah. And it's not just the dentist, it's even the staff. Like sometimes the more experienced they are, like you listen to, like we listen to 50,000 calls a month, right? Across practices in U.S. and Canada. You start to see like there are some practices that will, they'll book like 70% of new patient calls to appointments, and the average one will book 1 out of 3, like 30% into appointments. And often when the people that do a good job really engage on an emotional level, try to understand the patient, ask the right questions, and kind of like learn their sort of like where are you at and how did you get there and what are you really looking for? Like what does success mean to you? And the ones who are, been working in dentistry for 20 years, incredibly knowledgeable, they just go on a random tangent as if like, let me show you how smart I am. Oh, it sounds like it might be a problem with this. And I think we're going to need to do it's like by the end of the call, the person is more confused than when they first called. Right. So, and amongst all the receptionists, like there's maybe a couple hundred of them that we would monitor across all of our client base. It's like the best ones were sometimes like people who had worked in the restaurant industry, and a year ago they didn't even know anything about dentistry, right? But they understand how to engage on an emotional level. And I think some as dentists especially fall into this pitfall of it's too technical. You're trying to show me too many like medical elements. You're not helping me see, here's how life is going to feel once we do this, and look at what, like how these other people, like the journey that they went through, there's that disconnect. So you're right. When they're presented with the price, it's like, we're not really at the same level. I'm somewhere else and your values are something different. And often the dentist, the staff, they don't even understand what the value of the patient was. It's like, well, they want to fix their teeth. It's like, well, hold up a second, but why? What's the emotional reason? Are they, do they feel embarrassed in public? Do they feel like, I don't like myself when I look in the mirror. I don't like that, like what is it there? So it's interesting how you break it down. So are you asking the right questions to learn what their values are? Like how does that piece work exactly? Like how do you get them to the same?
Yeah, I have a 7-step process, 7 steps, which might seem like a lot of steps, but when you break it down into the time frames and appointments that are required for that, they build upon one another. And it works really, really well because we're always using visuals from step 1 to step 7, but in different ways. It's not like here's another before and after, here's another before and after. Everything has a purpose. Every single visual has a purpose. So for example, what you're doing with RevUp, a big part of what I would imagine you require for your clients to do extremely well is you need consistency.
Yes.
You need right?
Absolutely. Yes.
Right. It's consistency.
Yeah. One receptionist will say one thing, another one will say something so random. Another one, the next day, she explains something totally different. Oh my God, I have so many stories to tell you that are going to make you laugh. Like, what we hear on the phone. Absolutely. Yes. Consistency is huge. Yeah.
Right. So from the front end, right? Like one of the very first step of our 7 steps is awareness. If a person's not aware of a problem, there's no problem to fix.
Yeah.
So that's a huge part of why you use visuals is to showcase, right? If I show a woman who's already fairly beautiful, 24, 25 years old, and I'm like, man, the change is dramatic. It's gorgeous, but it's not really to most people. They look at it and they're like, maybe a little long, maybe they're a little bit wider. I don't know. That's very common. You'll see that a lot on Instagram. If a person has jaw joint dysfunction or airway issues or a bunch of mismatched crowns or whatever, they don't relate to that.
Yeah.
So that's gonna really limit your awareness. So using the right photography for your clientele is super important. If you have a website and you're building a website and trying to bring traffic to it, people are going to be, doing the hotspot top to bottom and then Xing out of the page. If there's nothing in between that says, I'm here for you. So that's part of the consistency is it's not just the frequency of what people do. I think we think of consistency, like how often are you doing it? There's also like the consistency of the thing that something's made out of. That's another way of looking at consistency. So you have to think about what is my primary audience interested in? What do they actually have as a problem? And let me present that in a way where they can attach to it and say, oh, I experienced that same problem. Email list. That's a huge deal, right? You have all these emails as dentists for your patient pool and no one talks to their patients that way. What they do is they say like, hey, we have a 25% off bleaching special. No one cares. What they do care about is, hey, we just walked, Susan through this and this is what she was experiencing. This said she came out the other side. Hope you guys enjoyed the case. Done. Awareness. It's all you're looking for, right? So I think that's a huge piece. Social media, you want to be doing it enough for people to think, oh, this dentist, he or she does this a lot. They must be really good at it.